Hello guys, this is Tasrif Ahmed. I just want to do a quick video, kind of like an introductory video, just to discuss some health topics that applies to cricket in general and specifically for RTP Tigers Cricket Team. So if you find this useful, please let me know, and if there's anything that you want to discuss further, um, let me know as well. I can make more videos in the future to discuss different topics that you're interested in. First of all, I'm not a replacement for your primary care doctor. So if your doctor is telling you something, listen to them. Also, I can only give you advice. I'm not supposed to prescribe anything in terms of medication, any x-rays, any labs. So I don't really have any way to do that. So this is just some advice that I hope would be useful for you guys. All right, so let's get started. So the things I want to discuss are what are common injuries in cricket and what are things we can do first to prevent them and also basic treatment options that we have available. All right. So why we want to talk about injury in cricket? So injury obviously sucks for any sports. We know of different players who are great and faced injuries and that prevented their career from advancing. So we want to do the most we can to prevent the injuries so we can continue to enjoy the sports that we love. So first of all, common cricket related injuries. So I'm sure you already know this, sprains and strains. So basically this happens with overuse, sudden movements, or improper warm up that basically leads to muscle strain and also ligament sprains. Hamstring and groin injuries are most common in cricket. Then we have shoulder injuries, which is basically what we have after repeatedly using your shoulders during bowling or hitting big sixes or trying to. That can lead to shoulder problems. Uh, Specifically, you can get rotator cuff tears or just rotator cuff tendonitis and also shoulder impingement from this type of activities. The next category is back injuries. So whenever you're doing fast bowling or long periods of fielding, that can stress your lower back, and this can lead to back pain after you're done, or sometimes flare up if you have back problems to begin with, your acute flare up of your chronic back pain. And then other common type of injury is ankle injury. So if you have any sudden, ankle turns like fielding, batting or bowling, you're turning your ankles quickly or running on an uneven terrain, that can cause your ankles to sprain. And that's why you have to have some kind of stability of the ankle. And this is where we highly recommend getting some cricket shoes so you can have some proper balance that can prevent injuries like this from happening. So since we're talking about prevention of injuries, so basically, like any sports, the most important thing you can do before any game or even like practice is to warm up. So I would recommend using at least 10 minutes. I would actually make it mandatory if I had a way. Uh, Give yourself 10 minutes to warm up, and that can involve different type of stretching that hits, all the parts of the bodies that we discussed, your back, your shoulder, your ankles, your core in general. Before the game is very important to do it, and that's number one way of preventing injuries. And then obviously hydration is another part of the injury that we sometimes forget or leave out. So before any match, especially if you're playing a summer, it's 90 degrees outside, you're trying to go there for a 20 over match or whatever, you need to hydrate yourself. So that involves hydrating the day before, the morning of, during the match, and then also afterwards. So on a regular day, you should be drinking at least 2 liters of water. That's for any average person. But if you're playing outside, if you're sweating, then you need to replace that water. And sometimes, depending on your body or your nutrition, you also need to take some electrolytes before. Um, so you can do like, Gatorade or other electrolyte mixes before the matches. And then it's very important that if you're playing at least, if you're at least 50% serious about the game, you actually need to maintain your overall fitness at a certain level. So you cannot just expect that, oh, I'm gonna show up on a weekend, I'm gonna play the game, I'm not gonna have any injuries, I'm gonna perform really well. It doesn't really work that way, unfortunately. And I want to first remind myself, and then everyone else, that we need to maintain some form of fitness level to be able to play the game in a safe way. So if your muscles are properly trained, they can perform better, whether you're batting or bowling or fielding. You need to have some fitness to be able to perform at a certain level that you expect. And not only can you perform better, but also reduce the chance that you're gonna injure that part of the body. So with the warm up, it's important to use the proper techniques when you're bowling, batting, and fielding. I'm sure there are tons of videos you can watch on YouTube. Just do a quick search and especially the fielding. We had a lot of missed fielding recently and a lot of injuries actually related to the fielding. People falling, injuring their ankles or their back. Just try to use the proper techniques, the proper technique when you're fielding in order to prevent the injuries, on top of everything else we just discussed. And then rest and recovery is also important. So if you're hurt, you need proper rest for your body to recover from that before you start playing again. Because if you add injury on top of another injury, it's just going to cause more problems and even require a longer period of time to recover from that. So that's basically things to kind of do what you can do to prevent injuries from happening, and we also discuss the common types of injuries. Now, if you already have an injury, or let's say in the future you have some injuries that you're not sure how to treat, so this is just basic information. If you have any complex injuries or anything like that, anything serious, you obviously want to see your doctor. But just for minor injuries, for most muscle related stuff, we recommend something called RICE. So RICE means rest, ice, compression, and elevation. So rest means not bed rest. You still want to maintain some activity. So I don't want you to get injured and just spend the next week on your bed, and that's not feasible for most people's work work requirement anyway. So try to rest that part of muscle that you injured or part of the body that you injured, but also try to do some therapy, stretching to help recover faster. Icing is important because it reduces the inflammation that your body produces in response to the injury. Compression, I actually love using different compression braces, which are basically elastic braces that you can buy from Walmart or other places. They're not very expensive at all. So if you hurt your ankle, for example, you can buy an ankle brace to kind of help support your ankle and also give some compression, so the inflammation there would be reduced by the pressure that the compression provides. So it provides some support and also the fact that the inflammation would be reduced. So it helps in both ways. So it does help with your pain. And also elevation, you can try to keep it elevated. So if you're lying down, you hurt your ankle, you're lying down, you can put a pillow just to keep it elevated to reduce again the swelling. And then that's for any acute injury. Also, you can take pain medication like ibuprofen. I highly recommend it for most people. Um, One exception is if you have kidney problems or have any other chronic medical diseases where you're not supposed to take it. So for most people, if you're healthy overall and young, you can take ibuprofen. If you buy the over the counter, which is 200 milligram, you can take three of them. So 600 milligram ibuprofen 3 times a day for 1 week can be taken for most of the injuries that we see in cricket. So that's the primary treatment. Anything more advanced, I highly recommend that you talk to your doctor directly, because some injuries need longer recovery. Sometimes you need X-rays, MRIs, and also referral to specialists like orthopedics, sports medicine, or physical therapy. So those are not something I want to discuss in our presentation here, because those are something you should be seeking medical care for. So I'm only providing you information about minor injuries. So anything more severe, definitely don't rely on my information here. You go see your doctor and let them take care of it. Okay. Um, So in closing, again, I wanted to emphasize hydration is very important. Proper equipment is very important. That means get yourself some cricket shoes if you don't already have some, and also definitely wear a guard when you're playing. Um, and then before you play any game or anything, you have to prepare yourself mentally and physically, and that means keeping yourself fit to play the game. So you don't go there on a weekend and just injure yourself. Uh, that's not something I want for anyone in the team to face. So definitely, exercise regularly if you can, at least 3 times a week. That way you're fit to play whenever we have a game. And definitely spend some time before you go to the field or when you're at the field, at least 10 minutes to warm up before practice or game. And that can really help prevent any injuries because prevention is key. We don't want the injury to already happen, which is, something harder to treat. If you can prevent it, that's better, right? So if you do have an injury, you can talk to me about minor injuries. I'll give you some advice. I cannot prescribe any medication or any treatment. I can give you advice. If you need anything further, that you need to talk to your doctor, and I can, guide with that if you want me to discuss that with you. All right. Well, I hope you found this helpful. If you have any feedback, then definitely let me know. All right. Take care, guys.